I'm now live. Waiting. Hello. Hi, I'm Kat. I'm all by myself. The Kat and Dave show is put on the shelf. Today it's medical, ear, nose, and throat. Meet my doctor, Linda Dahl. She helped me hit this very high note. Thank you, cutie husband.
Okay, baby. Have a great show.
He
hey,
wrote,
guys.
He wrote that song for me, like literally.
I mean, yeah.
He did.
Yeah.
Good
Cute.
job.
Very good.
I don't know why he doesn't want to be in this video with us, but he wants to go and live his life, which I understand. This is not really the Kat and Dave show. Hi, I see some fun friends joining. My doctor in New York, Linda Dahl, is a ear, nose, and throat doctor. Stands for ear, nose, and throat doctor. We call them ENT. And in the singer world, the Broadway world, the ENT is everything to us. So I'm going to have her join us today because she said she would ask some questions for us. Let's see if she's here yet. No, let's see. Hang with me for a second, you guys. Waiting for her. Oh, I love the technical difficulties. So Linda Dahl is a doctor in New York, like I said. How come I don't see her here? And I met her when I was doing, I don't see it, so I'm just gonna wait for a second. I met her when I was doing my first Broadway show, well, my only Broadway show, which was Waitress in in New York. That's where I started. And there she is. I'm gonna ask her to join. There you are. Okay, yes. She's really amazing. She's super smart. Obviously, she's a doctor. She should be smarter than all of us. And waiting for the connection. Okay, are you there?
Yeah, I'm here.
Hi, and she's beautiful too.
Oh, look who's talking right now. You're gorgeous. You look so good.
So, oh, thanks. So, I was just explaining to my viewers that how I met you, and I've also been seeing you on the TV like the last couple of weeks all over the place because people want to know what you think about all this COVID stuff. But I'll just briefly tell people how we met. I was starting rehearsals for Waitress in New York, my Broadway debut, and I started getting this really horrible cough. Now it's like the word cough nowadays is like a forbidden word. But my voice was really hoarse and I was making my Broadway debut and I was freaking out. I didn't have someone to see in New York because I'm from LA, live here in LA. And Nadia, who's our musical director on Waitress, she sent me to you. And I'm so excited that you're joining me because I have so many questions. I'm going to let you talk a little bit, but I have taken questions from fans who wrote in. But one of the things that I'll say, well, do you want to say a little bit of thing about yourself? I feel like I'm just talking.
I like listening to what you're saying. Yeah, I'm an ear, nose, and throat doctor, and I've been in practice for about almost 17 years in New York City. And I was seeing a lot of professional singers and Broadway performers. I see a lot of other adult patients as well, so it's not just singers, but it's everything. Like that. So,
I should say that like all the Broadway people go to Linda Dahl. This is who we all go to in New York. So okay, go ahead, keep going.
Yeah,
so you probably are not as busy as you were.
No, actually, sadly today, I was trying to hang on, but sadly today I had to furlough my staff finally, and now I'm just doing some telehealth till things pick up again. But for ENT, it's strange because we do the part of the body that is most affected by the virus at first,
right.
So you can transmit it really easily. So it's really tricky. Like I can't see my patients with masks on because I have to, look in their nose and mouth.
You have to literally be in their face and.
Right. So, and I guess in that sense, when this was all happening with COVID, it was pretty rampant in New York. Like the symptoms, now I look back and I think, wow, a lot of the symptoms of the patients I saw had these symptoms and then subsequently tested positive for COVID. So I've treated several hundred people with COVID, and for as long as I could. And then when I went to telehealth, it's mostly like through the phone with people that I know.
Right. Did you encounter patients that that you confirmed later that they actually had COVID and you were with them face to face without the proper, what are they calling it? What do they call it?
The personal protective or equipment. I guess that's what.
That's what it stands for. I was like, what does it stand for?
Like,
Personal protective equipment.
Yeah, there's all kinds of medical acronyms now, but
yeah.
Yeah, I was for sure. I mean, I think even myself, I think about the symptoms that I had in February. I was sick for a little while. I didn't know what it was. And now I look back and I think I'm pretty sure it was. And then a lot of people that I treated were later then confirmed to have had the virus. Yeah. And so, so I guess for me, you know, the idea of it, because it's in the media and everybody's talking about it and you know, it's associated with such scary things. The idea is really scary, but you know, I encountered it in its many different forms. So, you know, I have a kind of a different perspective or a broader perspective because I've seen people with very few symptoms and people with kind of moderate symptoms and then people who were very severe and had to go to the hospital. So it really runs the gamut. Yeah,
it's not like a one size fits all virus. It's something that attacks people differently. One of the questions that I got, and I ended up doing the waitress show, a lot of my followers know this, in London, and a lot of my London family, waitress London family, got sick and positive. Sarah Bareilles came out publicly saying that she got infected, but some of my really dear friends who I made through doing the show in London got infected. And one of the questions that somebody asked, I don't know if you know the answer to this, but why does COVID-19 patients develop lost sense of smell and taste? And when I spoke to my friends in London, they were saying that, you know, it's just this weird thing. You get hit with all these different symptoms, but one of the really big ones, thankfully, they, knock on wood, they didn't have to end up going to the hospital and getting serious, but was loss of taste and smell. And it's just such a strange symptom to get.
Yeah, it is. And it's very specific too. I remember just before I closed my office, I had a patient come in and said, you know, I woke up the other day and I just can't taste or smell. And just out of the blue, I'm like, that's really weird. I never, you know, I almost never see that because she could still breathe through her nose. So it wasn't like allergies or anything. And then the next day I was on a phone conference with other ear, nose and throat doctors in Manhattan. We were just talking about the virus and everything. And they were all saying, you know, I just saw a patient that lost their sense of taste and smell. And so now most ENTs are using that as a way to diagnose people, especially if they can't get the test, which most of us can still in New York. But so if you have, if you lose your sense of taste or smell suddenly and you can't, but you can still breathe, so no other symptoms, then it's pretty diagnostic. And the idea, or I guess the theory behind why that happens is that the virus can attack the nerve cells. And because it gets in through your nose and mouth, the smell nerve, which is right here actually between your eyes, is really close. So it can enter in through that nerve. And that's
well, that's the first place. It's either you're getting it through your eyes or your nose or your mouth. So that makes a lot of sense. So interesting.
But the good news is that most of the time it comes back. So usually the symptoms start between day 3 and 5. They last for a week, sometimes longer, and then it usually comes back.
Yeah, that was one of the questions that somebody else asked was like, you know, do you, okay, so there's so many questions that I have like COVID related questions and then also non-COVID related questions. But I'm curious, as a doctor, a woman who sees a lot of singers, we have a very close friend who was in the ICU and was put under, and thankfully we actually know 2 people. Oh, can you see me? Okay, I was wondering if I disconnected. And thank God they both came off the ventilator, but one of them, who we've actually spoken to since he's come off the ventilator, and he doesn't really remember that much. But one of the things that I noticed is the damage that's caused from being on a ventilator vocally. Oh crap, you can't hear me? Shoot. Hello? Can you hear me? Oh no. Can you hear me? Oh, I can't hear her.
Maybe you should go off the internet.
I am off the internet. And then should I get off and then come back on? This is so annoying.
Maybe you should go on the internet.
I am on the internet.
Oh, maybe you should go off the internet.
Okay, so you can't hear me. Oh my gosh. Okay, we'll go off. We'll come back on. So
Yeah,
until then.
good, very good.
Hi guys. Okay, we're back. I don't know how many of you are still with us. We're picking up. Hi Sahar. We're picking up where we were, and I'm going to wait for her to see if she's going to join back in. The phone sometimes just does not want to cooperate. Okay, so here she is. Let's get back. See if she'll join us again. Waiting for Dr. Linda Dahl. There you are.
Good. I just
I'm sorry.
my phone. No
I
worries.
feel like sometimes just with the going live with Connected, it just goes in and out. It just doesn't want to
No
cooperate.
worries at all. I am on my phone now.
But what were we talking about? We were saying.
Oh, you were going to ask me a singer question, and you were saying that you had 2 people that were in the ICU.
Yeah, we had 2 people that were in ICU, and one of the things that we, it's very obvious when you speak to them after they've come out of being on these ventilators for a very long time, their vocal strength is completely gone. Their voices are gone. And I'm curious what you think is the long-term effects of, when people have surgeries and they're intubated after a 2-hour surgery, their voices are husky and it's hard on the vocal cords. I'm curious what you think the long-term effect is for people who, we know, I don't know him, but Nick Cordero, who I've been sending lots of prayers for, his wife and him, he's really been fighting, but he's a beautiful singer. I'm just so concerned about these people who not only are fighting for their lives, but their livelihood when they get back and get better into society.
Yeah, for sure. I mean, the intubation that people have when they're having surgery, I should say not specifically vocal cord surgery, but just like regular surgery.
Yeah.
Usually it's just a certain amount of time, and then when they get extubated, it's okay. Vocal cord surgery, there is a recovery because the surgery is actually on the vocal cords.
Vocal cords, yeah.
But with this intubation, it's really different because the tube sits between the vocal cords for a long time. And also,
so they're separate. Just for people who know, when you breathe out, take a deep breath, your vocal cords separate, right? That's how the vocal folds work. So
right. And so the tube sits and kind of rests on the vocal cords when they're on the ventilator.
Right.
And then in addition to that, because they're not moving at all, the muscles in their body get smaller. They thin out.
Atrophy, right?
They atrophy, exactly. And the vocal cords are also muscles, so they atrophy as well. So that's why, when people have been intubated for a while, there's a lot of damage that can happen, and also to their lungs.
I'm sure to their lungs. Our friend was saying that he has to do a lot of rehab, but I was just wondering, it must be not just physical rehab, but also vocal rehab.
Vocal rehab for sure. Absolutely, for sure. Yeah, because the vocal cords are muscles too, and then the lining over the muscles, the vocal cords are muscles, and there's a lining on top, and the lining is what vibrates. So when the vocal cords come together, that lining vibrates, and so if the vocal cords are thin, then that doesn't work as well either. Or if they're swelling, it doesn't work as well either. So
it's really not an easy road when you have to go through that. I want to move a little bit away from depressing COVID just for a second and talk about overall immunity health, because when I met you, I started to, my very first live, I was starting to talk about how I met you and I was really sick. And I remember one of these things, this instance about you, you may not remember it, when I said, hi, I'm really sick. I don't want to shake your hand. You came in, you didn't even wear like a doctor's jacket. You just look so cool. And you're just this whimsical Western doctor, but I feel like you have different approaches as well. And you said, oh my gosh, I take so much vitamin C and all these different immunity boosters. Like, I'm not going to get sick. And you shook my hand. And I know as an ENT, you must see sick people all day long, singers and non-singers. And there has been a lot of information about like boosting the immunity. And there was even stuff that I read about in China. They were doing IV drips for COVID patients. And I feel like we don't tend to do that so much here in the States. We're more of like a Western approach, and we don't really think holistically. But I'm just curious. I love you as a doctor because you are a Western medicine doctor, but I think I'd love for people to hear some of your take about overall boosting your immunity, what that actually looks like. And and then what you really think about all the vitamin C with the COVID stuff. And so take it away.
Sure.
Do you remember doing that when I walked in?
Of course I do.
Yeah.
I mean, I think, I, as an ENT, and I was exposed, have always been exposed to a lot of viruses and bacteria and everything. But I do take a lot of supplements, and I think for me, it makes a big difference. And there is, I mean, I think Western medicine, you're right, tends to kind of wait for the illness and then try to treat the illness, which is what you see on television. People are talking about drugs to
antibiotics.
To kill the virus. Right, like the drug to kill the virus, or wait, when people are really sick, then go to the hospital and then get all these treatments and everything. So, and I'm sort of more on the other side of it. If there are ways we can boost our own immune system and also treat some of the early symptoms, then maybe that can help keep people out of the hospital.
Right.
Which is, and so one of my favorite, and actually, I'm in New York.
Yeah, so tell us your favorite.
My favorite is vitamin D, my very favorite.
I just started taking that because I've read a lot about it.
Yeah, so vitamin D, especially in the Northeast and places where we don't have a lot of sunshine, but also in places where people wear a lot of sunscreen or they're inside with air conditioning. It's the same sort of thing.
Right.
But vitamin D, we mainly get through the sun. There are certain foods that have vitamin D, but it's like salmon and avocado. It's really hard to only get your vitamin D from food. Right. So you either have to take a supplement or be in the sun. And
do they, I'm sorry, where do they derive a vitamin D from? If it's mostly like something you get from the sun, how do they make a supplement? I mean, you may not know the answer to that.
It's a good question. It's a brilliant question. I have to research that.
Yeah, it's fine.
Probably a bunch of salmon.
I never said you were a supplement expert.
That's a really good question.
Yeah, I'm sure there's different.
Yeah, I know. I remember reading about it. There's a certain source of it, but it's actually really inexpensive. It's really easy to find.
Yeah.
And they fortify. So people think that you get it through milk and cheese and things, but they actually put it in the milk and cheese.
Wow,
it doesn't naturally occur in that. It's just fortified. So, but if you have enough, enough vitamin D, then your immune system fights off infections. And if you're low in vitamin D, then your immune system becomes more sort of allergic and inflammatory.
Yeah, I mean, I my blood work, one of my doctors a couple years ago had said, you're low in vitamin D. And I remember kind of being like, oh, whatever. And for women, it's very important. I know that as well. I mean, it's important for men and women, but I remember kind of thinking like, whatever, I don't really know. But as I've gotten older, I paid attention more to like these things like boosting immune system, and vitamin D is, someone was writing as you were speaking, what is like the correct dose of vitamin D? I've heard from like my dentist, this dentist that I went and saw, he was like obsessed with vitamin D. This was a couple years ago. And he said like, you can take so much vitamin D, it's not going to hurt you. It's only going to be helpful to you. I can't imagine that to be true.
No, that's not true. So there are 4 vitamins that are called fat soluble vitamins, K, A, D, and E. And those are the 4 vitamins that you can overdose on. But everything else you can take, the other vitamins and you'll just get rid of it, like pee it out or whatever. But for vitamin D, there's definitely a limit to what you can take. The recommended daily dose is 800 IUs, but if people are low, they can take a higher dose.
Right.
But it's also really hard to have too much vitamin D. Like you have to take it for a really long time to get high vitamin D. So it's best to kind of work the dosages out with your doctor. But and if you're low, some people need to also be in the sun, and if they don't absorb things well in their gut, then they can take a bunch of oral vitamin D and it still won't get absorbed.
Right. Yeah. I mean, with all the time that we've all had, and then some days you wake up and you're like, oh my gosh, what can I work on today? Like yesterday I decided I want to improve my flexibility. Like I've not been stretching enough, right? So I'm sharing this because everyone's looking for things to do. I've also been working on my drinking every night. That's also helpful as well. We could talk about that in vocal health as well.
We can talk about that.
No, but I remember you told me that like stay away from red wine when you're on Broadway, and I did. And it was red wine does. We can talk about that after. But what I was gonna say was, and I lost my train of thought. Where was I?
Stretching.
Oh, having like a new thing to work on was I've literally been trying to be diligent about vitamins and immunity health, because when you're a vet, you're fine and you're running around and you're going to work, you don't take the vitamins like you should. And what I have done, and I've been guilty of, is when I start, like when I was on Broadway, oh my gosh, I'm getting sick. And I would like not crush, but like literally just take so much zinc, vitamin C, and I would be able to fight it off. But I always thought to myself, if I could just be consistent with taking vitamins, and it's not that hard, I don't know why it seems like a chore, that I would probably not get sick as often. So I know that seems weird, like something to work on, but I'm trying to work on being consistent with, you know, it's like you drink water every day, you should take your vitamins every day.
Yeah, and if you think of them as kind of like a food, you know, not, there you go, she drinks, not like a, you know, I think we think of pills as medication, and we think, oh, I'm taking a medicine every day. But if you think of vitamins as just another form of food or something to supplement your food, then it can be really helpful. Yeah, there's so many supplements that can be anti-inflammatory, that can clear your liver. That can boost. You were talking about the vitamin C IVs as well. Yeah, they were using them in China. They've used them.
That's not a myth, right? That was actually.
It's true. It's high dose vitamin C IV. It's so the dose is so high that you can't take it orally. You have to get it in IV. And they had some mixed results, but I think there's so many different treatments that people are trying. Just to see if anything works. Yeah.
I mean, it is true that there's so much unknown. I mean, expert doctors like you and many, many others, they've just been surprised by all this, right? I mean, there's so much we still don't know about it.
It's trying to understand how this virus works, trying to understand how our immune systems work. All while people are dying. And so it's a lot. It's a lot.
And is it true that with this particular, with COVID, that it's your immune system, our immune systems are so powerful that your immune system almost turns on you? It works against you?
Kind of. The reason people don't get sick from the virus, so the virus doesn't go in. It does some damage, but not a huge amount of damage. Most of the damage that makes people really sick is their immune system's over-response to it.
Over-response.
Yeah. So if you have a healthy immune system, then your immune system will sort of measure its response. You know, you'll get kind of sick, but not horribly sick. But for some people who have weakened immune systems, it's sort of backwards, right? So their immune system isn't as strong, so it overreacts.
Overcompensates or something. Yeah.
And that's what makes the lungs fill up with fluid, and it makes people really sick.
Right. I want to say that one of the things that Dr. Linda Dahl and I'm speaking to our followers now, that we spoke about, there's a couple, lots of personal questions, a lot of Scorpion lovers too. I'm like, this isn't about Scorpion or Smash, but I'm sorry, I'm glad you all miss Scorpion. I'm sorry it's not on. That you, because they're not your patients, these are just people on social media. You can't speak to specific ailments, like, you know, someone's talking about whether they should have surgery or not, and you can't, obviously, nor would I ever recommend that unless you knew that personal situation. So there's a lot of questions that but we do have a lot of singing questions. You know, there's so many, you know, I've come to you with vocal injuries and things like that. I think there's such, for any singers who are watching, there's such a stigma on vocal injury. And we don't think of vocalists as athletes like we do with athletes in football. They sprain their ankles, they tear their ACLs all the time. And with singers, when a singer injures their voice, we look at it as like, oh, well, they probably were just doing something wrong. And it's like, really, we're doing something that isn't really what our voices are built to do. I mean, we're doing gymnastics with our vocals. So I just wonder, how many of your patients go in, because I know I felt this way, they must feel like shame around having the pressure of having to do a show every night, and also feeling like embarrassed that they have a vocal problem. Is that common? Because I know I felt that.
Yeah, I mean, it's what I do all day. I think if it didn't happen, I wouldn't be necessary. So yeah, it's really common. And I think vocal injuries are really more a result of illness and random acts of, you know, coughing and sneezing. For most people, I mean, I work with all different types of singers, but when people get to the level of like you, or they're on Broadway, I mean, they know what they're doing. So, and the injuries actually come because the schedule is insane.
Yeah. And the talking is really
talking more than the singing, right? So when you, like, for example, when you went into your show, it wasn't just that you shows a week and the previews, which, by the way, explain to people what that is. That's rehearsal all day, and then 8 shows a week, and all the press that goes with it.
And then they have you come in and they have you shoot like a commercial that you've just opened the show. Like in London, I experienced that. We opened the show, and then the next morning I was there at 9 a.m. to shoot a commercial. And I just decided to not talk all day and lip sync to what they wanted me, because it's not sustainable. It's not sustainable. You have to you have to be your own advocate, right? Like,
absolutely,
as a singer.
Absolutely. And so injury, so in that sense, like that's your workload. And so injuries are more, sort of normal. I mean, I think it would be impossible for people to not have trauma and injuries when they're doing that, you know, degree of talking and singing and everything.
Yeah.
So, you know, so and it is really more about managing it. Like I like to be proactive and, you know, use the natural anti-inflammatories and immune boosters, and then treat inflammation early so that it doesn't get worse and then you're out. And you know, because it's best to avoid like some of the stronger drugs for a long time for that.
Yeah, I mean, the staying away from the drugs, and just the best is knowing when to speak, not when not to speak. And I mean, you got me through. Originally I was supposed to do 10 weeks on Broadway. It was my first. I had no idea I was going to get through 8 shows a week. And I was really sick when I got to New York, and you got me better. And I don't think I missed like any shows. I actually didn't miss hardly any. Unfortunately, my father died, and I decided to extend. And so that was the only reason why I ended up missing like a week. But I mean, it's a rough schedule, but
you did really well. You did really well.
With someone like you, a great doctor, and really learning your own voice, and you know, you make mistakes, you create injuries, knowing when to like say no to the drink after the show. And you know,
it's a tough lifestyle too. Yeah, for sure. But yeah, you did really well. I have to say, like most people that, you know, a lot of people on Broadway they're training to be on Broadway, but when people come into Broadway that haven't done a lot of it live, I mean, that's the hardest thing, because it's
different.
It's different. Yeah. It's like jumping into the Olympics with very little training.
Yeah. It's the thing I tell people, the thing about Broadway is it's not so much that the 8 shows are so hard. It's the waking up in the morning and having the anxiety of going, oh my gosh, like, is my voice here today? Is it not? Is this scratchy throat actually me getting sick? Is it not? And you get the pressure not only of the people who've paid to come see your show, but also like so-and-so's friend is coming to the show. And if you cancel, then that person's gonna be disappointed along with all the thousands of people who are. So it's a big responsibility. It's the anxiety that weighs on you night after night after night. It's not so much like the 2.5 hours, I think, in my personal opinion.
You're right.
It's getting in the shower and going, ooh, hearing if there's anything going on in your voice. So it's a lot of mental stuff. I'm trying to think of, this is something that I've been doing. I feel like I'm not a doctor. This would be my recommendation, but this person, Len, said, must I disinfect my groceries before putting them in the cabinet? I never did stuff like this. We would go to the grocery store and put stuff in the cabinet, never think to clean it off. And I'm already kind of psycho about cleaning stuff off. And like the airplane, I was always cleaning stuff before all this COVID stuff happened. But what do you say? I mean, at this point.
Yeah, I mean, in the airplane, I definitely agree with you because they circulate the air. But with groceries, I mean, it's hard. Like, obviously, with fruits and vegetables, you should wash them like you normally do.
Right.
But if you're worried about the virus living on cardboard or in your groceries and things like that, I think you have to think about it's possible. So all of the studies that they quote all the time about the virus living on different surfaces are scientific studies. So they're in a lab and they're testing under perfect conditions. But when, you know, if it's something is in the grocery store and then it, you know, somebody delivers it to you and then you carry it and, you know, it's windy outside or whatever. I mean, it goes through so much different environment.
Yeah.
You know, there's so much different in the environment. It's hard for the virus to live. So.
I would almost want to say like the chances of that actually happening are probably more slim than passing somebody or, you know, being directly in contact, or for you, in this instance, like you're directly in contact with people who've been very, very sick. But I think for the average person, the mental game of not doing it is just people are freaked out. People are scared. There's just so much anxiety about how you get sick. And so I understand why people do it.
I mean, it's the virus lives better in warm air and better in people's bodies.
Right.
And it's very hard it's very hard for it to live on cardboard and metal surfaces. It can. But you know, so it's on the cardboard, like how are you going to get it into yourself? You know what I mean? It's hard for it to get into you.
No, it's true. But again, it's like that mental game of like, but what if? And I'll actually, my husband, his friend, I'll name nameless. He actually lives in the same. This is fine. Like Bill Gates lives in the same community, and Bill Gates has many houses or whatever. But they were playing. This was several weeks ago. But you know, Bill Gates was very aware of this virus and has been sounding the alarm about the potential harm of this for years. But he was playing tennis like, I don't know, 5 weeks ago when this all started. And he said they weren't coming into contact. They were playing tennis, and the friend who we're friends with was playing tennis with him. Said, well, what about the balls? We're both touching the balls. And he says, like, the virus can't live on the balls. So, you know, I was like, not to encourage people to go out and play tennis, because I think we all need to stay at home, and as long as our medical professionals and government people tell us. But I thought that was an interesting story that Bill Gates was like,
and I think
not worried about the ball.
They're right. They're not as worried about the ball, right? But I mean, in New York, going outside, you know, maintaining social distancing outside though is good for you,
right?
Because the virus gets dispersed in the air. In the air, yeah. And I know that there's some places around the world where they're telling people not to even go outside, which is actually sort of the opposite of what the CDC is saying about the virus. You know, like it can, like if you're in close proximity with somebody in a closed space, it's easier to share aerosols that way. So, but if you're outside, and especially if you have a mask and there's no one around you, then it's very hard to contract anything.
Right. Mm-hmm. Yeah.
In the closets.
And I've heard the other thing too, like you keep hearing about this, is it possible that a second wave could hit in the fall or worse? And I'm sure you've heard that before. And I don't expect that there's any way you could, you know, I've heard lots of medical professionals 8 weeks ago talk about how this wasn't going to be a threat to America. And, you know, it blew up and it surprised all of us. I could say, I think we can all agree. And so for someone to be able to predict whether or not it'll actually come back in the fall or be even worse, I don't know how one could predict that. Do you have any findings that research?
They can't really. So it's a specific class of viruses called coronaviruses, but there are other viruses, like the common cold is a coronavirus.
Really?
The SARS virus.
So I knew SARS was part of coronavirus, right?
Yeah. But the most common coronavirus is just the common cold. But there's SARS, and then there's also MERS, the Middle Eastern one. And SARS and MERS were much more lethal. So they weren't as it was
transmittable, right?
Right, not as transmittable, but very, very lethal. And so when that happens with a virus, it tends to die away really quickly because everyone it infects, the people that it infects die more easily. So then the virus dies too.
Right.
This virus is interesting because we're still trying to figure out how transmittable it is. And if it is airborne, like it kind of seems like it is now, then a lot of people are getting exposed to it, but we won't really know the true nature of, I guess, the true percentages of deaths that it causes until later. But the second wave is really, the concern about the second wave is that all the people who haven't been infected yet, if they get infected in the fall, and it's the same season as influenza, which is the flu. So they're really worried about those two infections happening at the same time. Right. That's why they keep talking about a second wave. Yeah.
Yeah, I wonder, I've been curious about whether the numbers of COVID deaths, which there's no death number that we celebrate, obviously, but because people have been staying inside mostly, that I think, what did they say? It's like 60,000 deaths a year or something from the flu. It varies. 60, it varies
throughout the year.
Throughout the year, it varies. But like, I just wonder what the regular flu and whatever that even means, what those numbers will be like, because whatever the string of the flu is for this year will be down maybe.
You know what's interesting is that as soon as people started getting COVID and we started social distancing, the incidence of the regular flu went away because that gets transmitted by droplets, and so people aren't getting infected with it as much.
Right.
So, but then they are testing for both the flu and COVID at the same time now too. But yeah, the flu, people with the flu, it really went away because using masks and social distancing,
it's helped.
Really works for the flu because
I know. I really wonder how going forward people are going to behave now. I mean, the seeing people with masks out is just totally normal now. I mean, a couple weeks ago, we didn't see anybody with masks, and now everywhere you go, there's masks. And, you know, at least you don't feel silly doing it because, you know, you're protecting yourself and you're protecting the people around you. And what else? Anything else? I'm like, I hope we're through this pretty soon. There's some personal questions, which obviously you can't respond to because, you know, they're not your personal patients. I hope that people who've tuned in, like the first tune in, they found this really interesting because we're so lucky to be able to talk to you and get your expertise, your medical expertise on things. I'm trying to see the new normal is better for our society. Always worth that. So is there anything you'd like to add? I'm so grateful that you wanted to join in on my live.
Yeah, well, thank you so much for having me. I think it's really, I think it's really great too for you, you know, to sort of show, you know, the people that follow you, or I guess give them some more kind of calm advice, because I think so much of what we see on television is one extreme or the other. And it's, I mean, even for me, knowing what I know, if I sit in front of the television for too long, I start to get nervous, panicked in ways that are unreasonable. So there's a lot of extreme information. And I think
there is you're absolutely right. The information is like, when this all first started, I was glued to I love the news. Like, I like to know what's happening in the world. I like to take the information. I keep it to myself, what my opinions are. I don't, you know, there's a lot of people that love to give lots of opinions, but I like social media to be a place that's just like for entertainment and all that fun stuff. Right. But on a personal level, I love to just get information, right, from different outlets. And I was just sucking it up every day. And I was loving it. And then in the last 2 weeks, it's just like, I felt the same way. I'd like to echo what you just said. It's like, it's just, I can't even watch it anymore. It's too, not that I don't want to be aware of what's happening, but it just, until they say like, these are the new orders. I feel like there was so much misinformation in the beginning about, how bad it was going to be versus now how bad it's actually going to be. And again, like I said, none of the people the number of deaths are all bad, but at least the numbers are much less than what they were saying it was going to be. So
yeah, and I think that they, like the government and really had to act hard at first,
for sure,
because then they can always back up and say, look, you know, what we did was important. And I think if they let it go for too long, you know, and things got much worse, then it would have been worse. But now we're in a tough place because it required, I think, so much fear to get people to stay home. Like, they really had to turn it up. In the media.
I was one of those people. I was like texting my mom. I was off work for that week because I started a new show and I had a hiatus, and I was like fear mongering my mother. I was like, you need to get out of the restaurant right now. But, you know, I mean, we've seen how New York has been hit so hard, and thankfully California hasn't been hit as hard, but it's just, there's just too many unknowns. And I just hope that we all, I mean, the whole world can get back on track. And you know.
Yeah, and I think if everyone kind of cuts each other some slack and realizes that nobody has a crystal ball, like nobody knew how this was going to turn out, and people are we're going to make all kinds of mistakes moving forward, and even, you know, like we'll move forward and then we'll have to take a step back. And I think, you know, but when you're trying to govern large numbers of people and also just kind of manage lots of people around the world who are also like losing their jobs and they don't have livelihood, they don't have food. I mean, that's a lot. It's a lot.
Yeah.
So it's, you know, in retrospect, we'll look back and we'll say, oh, it could have been done so much better. But, you know, as we're going through it, it's going to be hard no matter what road we take.
Yeah. There's so many like interesting questions and things that I've thought about. I'm like, okay, we're going to go so we can have what is it, Wednesday night now? But the last thing I think I can ask too is, you hear about viruses mutating, right? So like the new strain comes along, and are people talking about that in the medical world? Like about a new, is that what they're talking about? A second wave? It's a mutation, which then makes it harder to, like a vaccine would not even help with something like that, right?
Yeah. Again, a bunch of unknowns, because believe it or not, there's never been a vaccine for another coronavirus.
Right. Like SARS never,
never had a vaccine.
Right. Because it basically died down is what I understand.
It died out. Yeah. MERS, they didn't have a vaccine because the numbers were so low, I think. But also, things like this are very exciting when they're happening. And then when they die away, they lose funding, so they can't continue to develop the
Right. That was the big thing. They lose funding.
Yeah, they lose funding. So I think, but for this, it's already mutating like crazy because it's kind of everywhere. It's so easily transmittable. But those are questions like, is it going to be one vaccine? Is it going to be multiple vaccines? Will everyone need one? And if you get a vaccine, will it work in everybody or not? Yeah.
This is an interesting thing that you said earlier too, like the people who have compromised immune systems, their immune system ends up working against them.
Mm-hmm.
But I wondered if the people who, like, let's say they lose their sense of smell, they lose their sense of taste, if those were the people who were having a different strain of corona, right? Like it's a different mutation of corona, and the ones that getting really, really sick are like a worse version. Do we even know if?
Yeah, no one's done those kinds of, again, because then it all goes back to like, have they done a study? But they're like doing studies in real time.
Right, in real time, you're trying to keep people alive. You can't.
You're trying to keep people alive, yeah. I mean, I think 40 to 50% of people who contract the virus they lose their sense of taste and smell.
Oh.
But if you're going to have a really bad reaction to the virus, usually it happens within the first week. So it's rapid. And the scariest consequence of the virus is that your lungs fill up with fluid where you don't really realize that you can't breathe, except it feels like someone's like sitting on your chest. And then by the time you get to the hospital, your oxygen levels are low.
Yeah. And you're like going onto a ventilator. You don't know what's going to happen. Yeah.
But my hope is that, that people start to think about boosting their immune systems with natural things like vitamin D, and diet, vitamin C, things like that, and that the focus of the treatment shifts from waiting till people are really sick and have to go to the hospital to more preventative treatments. That's what I would like to see.
That's why I was excited to have you do a live with me, because long before COVID, and for people who are just tuning in, when I met you as my ENT in New York, you've always been about immune boosting health, immunity health, and we were just talking about these things. And every day you wake up and you go, oh my gosh, like for those of us who are not at work, like my work has been shut down, and thankfully there are lots of people who are still going to work because we need them and we salute them. But things you can work on every day. It's like work on looking into immunity boosting, right? Like things that you can actually do so that when you do go back into the world, you are well equipped to, maybe you'll go back into the world. Is it possible to go back into the world like having a better immune system?
Sure. And I think that with, people whose immune systems are strong, where they can like be exposed to the virus and then get over it will help. That's when they talk about herd immunity. That's what they're talking about, where the people who have a healthy immune systems can catch the virus and then develop their own antibodies. So there are few people in the population who can get sick. So it kind of strengthens the herd, or it strengthens, the whole population in general. But yeah, because I think the fewer people who are prone to getting sick, the better. And if you think about when this whole thing started, they kept talking about the stay-at-home orders being to help flatten the curve. And I don't know if you've noticed, but like nobody talks about that anymore.
Right.
No one really talks about flattening the curve anymore. And everything has shifted from flatten the curve to avoided at all expenses. So it's somewhere along the way, the whole narrative shifted. And I think that what we did really, while we're still learning about the virus, we've definitely, it's flattened, like the number of deaths happening every day isn't going up and up and up anymore. But now, in terms of getting back to life and getting outside again, it really has never been about totally avoiding the virus, because I don't know if we can. I think if it is airborne, especially, then there's just no escaping it.
So you would say, to leave all of our viewers, you would say that vitamin D is your number one favorite.
Yes.
And then vitamin C.
Vitamin C is also wonderful.
Always a favorite.
Healthy diet of whole foods, lots of water and hydration. Also, I mean, simple things like, because it does live in the sinuses, things like those saline sinus rinses, if you can stand them. And there's a lot of natural products for the sinuses. and anti-inflammatories that are just like natural products as well. Those all are really helpful when it comes to something like
Right. Someone keeps asking about elderberry, which I never.
Yeah.
Is that what is
Actually,
that?
yes. So elderberry is a natural I think it's like an antiviral, anti-inflammatory, which is generally thought of to be really helpful to help with colds. But elderberry specifically is, I've just read on doctor forums that they believe that it makes the virus grow better in you. So it's best to avoid elderberry, just like avoid Advil.
Right.
And ibuprofen and the same sort of thing.
Yeah. Wow, that's so interesting.
No one knows why.
No one knows. Well, eventually, hopefully we'll know.
Mm-hmm.
Yes. And then I take a prebiotic as well that I really like. I don't know what the difference between a prebiotic and a probiotic is.
Mm-hmm.
I don't know if you're supposed to take both or.
You're supposed to take both. Probiotics are healthy bacteria, and prebiotics are like their food.
Oh, interesting.
Because they're bacteria that live in your gut, and the prebiotics are food that your body can't digest, but that the bacteria can.
Yeah, I've just kind of started to get into, one of my other friends is really into gut health and how having a healthy gut is a really important thing to immunity as well, boosting immunity. Everyone can, with Google nowadays, you have to be careful where you get your information, but so you would recommend those two things too. I didn't realize that you should take both pre and pro.
Yeah, the probiotics, and there's a lot. I mean, there's so many on the market now. It's really hard to sift through all of it. And when I prescribe it for my patients, it's usually a medical grade one. That's a really specific one. But yeah, I mean, there's, you can take too many too. So it really is an individual thing. Mm-hmm.
Right. Yeah. Well, I want to say thank you for joining me. I hope I didn't, talk more than the doctor did, which I probably did.
No, you're wonderful.
So, but anybody who doesn't know what ENT stands for, it's ear, nose, and throat doctor. Someone was just asking about Advil. Yeah, I mean, I try to avoid Advil and Tylenol as much as I possibly can, unless it's like women menstrual cramp time, and I have to. Advil is really bad for singers, so I try to avoid that as well. But I'm trying to let you go so you can have your night. But yes, for people who just tuned in, ENT stands for ear, nose, and throat doctor. I'm so lucky to have had you on our live. And I think everyone should have a good ENT because when you get a cold, when you get a sinus infection, your regular internist can treat you, but there's nothing like a great ENT who can look inside your ears, look inside your throat, and just know exactly how to treat you. And you're definitely one of the best.
So thanks.
I always say, like, I look forward to seeing you, but I always hope that I never have to see you.
Right. Yep.
Yeah.
And I always say if I do a really good job, then all my patients break up with me.
Yeah, exactly. It's good news when you're not seeing your ENT.
Right. Exactly. Thank you so much for having me.
Oh my gosh, you're the best. Well, maybe we'll do like a follow-up when we'll see how things are in a couple weeks when, maybe things will, well, we have to hope for things to be better in a couple weeks because they're looking to be that way.
Yeah, I think so too. I hope so.
Yeah. And thanks for talking about how there's just a lot of noise out there, and it's sometimes good to just turn it off, and we're all doing the right thing by trying to stay home and boosting our immune system and doing what we can. And we thank you, doctors, nurses, medical staff, just people who, this is what you guys do every day. It's really amazing.
Thanks, Kat. Thanks again.
Yeah.
Thanks for having me.
You're the best.
Thanks.
I hope I see you when I'm on Broadway again one day.
Me too. All right, bye.
Okay.
Bye-bye.
Have a good night. Bye. Bye, everyone.
Bye-bye.